The nature of this video involves informed consent. Informed consent is an ethical and legal consideration involving the patient's acceptance or refusal of a line of treatment based on the information provided by a healthcare provider. Meet Aristella. She is a registered dental hygienist who recently started working at Dr. Payne's office 2 months ago. Aristella is a single mother of 2 young children who struggled to secure employment due to the recent and sudden death of her husband. She enjoys her new job and is fortunate enough that the hours are flexible to accommodate her children's school schedule, as well as being located just blocks away from the school and her home. Mr. Vitu is bringing his 10-year-old son Sovan to the dentist for the first time. Mr. Vitu and Sovan recently immigrated to California from Cambodia 3 months ago and do not speak much English.
Hello, Mr. Vitu. Hi there, Savan. What brings you in today, Savan?
Ow! My tooth hurts!
Okay, let me take a peek inside your mouth and see what's going on. Mr. Vitu, we're going to go ahead and take x-rays to see exactly what's going on with that area of Savan's mouth. Savan, I'm going to take pictures of your teeth now to see what's bothering you. There's definite gross decay on numbered teeth.
Yeah, you're right. Let's explain to the father that he needs number T extracted.
Despite the language barrier, Aristella tries to communicate to Mr. Vitu that Dr. Payne will most likely have to remove the tooth.
Mr. V2, the x-rays show that Savan has a very large cavity on this tooth. It needs to be extracted. If the baby tooth isn't extracted, it can also affect the development of the adult tooth, potentially causing a cavity.
Mr. Vitu says no and does not want his son's tooth extracted. Aristella looks over to Sovan and sees him whimpering in discomfort.
It hurts! It hurts! Make the pain go away!
Due to the lack of communication with the Vitus, Dr. Payne instead tells Aristella to dismiss the patient.
Aristella, please dismiss the patient. The father has refused treatment, so there's nothing more we can do.
Aristella faces an ethical dilemma, knowing that young Sovan needs further dental care, despite the refusal of the father and Dr. Payne's lack of care. Since Sovan is a minor, Mr. Vitu has the right to make decisions regarding the treatment of his son. There is also a language barrier, and Aristella is not sure if Mr. Vitu fully and completely understands the situation. Despite the need for an extraction, the father has declined any treatment. Aristella doesn't know what to do. Being a mother, she wants to do more for Sovan. However, if she doesn't respect Dr. Payne's wishes, she risks being fired. What should she do? How can she best handle this situation?
How can I approach this? What more can I do for Savan? He's in obvious pain. If I dismiss Savan, I'm not doing my duty as a hygienist to promote beneficence, but then I would get to keep my job. Or maybe I could refer Savan to another clinic that speaks Cambodian. That might upset Dr. Payne if I go behind her back and refer the Vitus to another clinic. I'm just not sure Mr. Vitu fully understands the situation. I want to do what's best for Savan, but I also can't afford to lose the job that I love. Maybe there's one more option.
After some contemplation, Aristella approaches Dr. Payne about the ideal resolution.
Dr. Payne, I'd like to revisit the options for the Vitus. I would like to recommend using a translator phone service to communicate the treatment plan to the Vitus. I don't believe they are fully informed, and I think the translator can help them understand their situation.
I think you're right, Aristella. Let's go ahead and call the translator service and have them explain it to them.
With the use of a translator service, Aristella and Dr. Payne were able to explain treatment options for Sovan, including the risks, benefits, and alternatives. Now Mr. Vitu can make an informed decision regarding his son's dental care.